Hey, this is Chris Dewey from May River Medicare Insurance, and today we're talking about veterans receiving VA health benefits who are also enrolled in Medicare Part A and Medicare Part B, or perhaps folks with VA health benefits that are about to be eligible to enroll in Medicare Part A and Part B, and they're not sure what to do yet. This video will not delve into Tricare for life, those vets that put in 20 plus years in the military, or family members of veterans who are Champva, because once you turn 65, Champva requires you, Tricare requires you to enroll in Part A and B or you'll lose it, all right? You don't have a choice. You must enroll in Medicare or you'll lose your Tricare Champva. But with just regular VA health benefits, you've got a choice. You have the option of declining Medicare coverage when you turn 65 or on your Part B effective date. Now, keep in mind, the Department of Veterans Affairs strongly recommends you enroll in both Part A and Part B when you become eligible for Medicare. Why do they strongly suggest getting Medicare? That's what this video is all about, but relax. I'm going to show you a way where you can get Part B at no cost or very little cost, let's say $35 a month. VA will never tell you about this loophole. They can't, actually. So this video will drill two huge points home for vets currently on Medicare or vets about to turn 65 and they're on the fence. Maybe you're uncertain if you should enroll in Medicare since you already have VA health benefits, you're happy with them. But my first point is this: you should definitely enroll in Medicare Part A and B for three huge reasons I'm going to outline in this video, one of which is a lifetime penalty if you delay enrolling in Part B, and maybe down the road you change your mind. My second major point is there's a way you can get all or most all your Part B premium paid for, the $185 they take out of your check each month. We can get that back for you each month in the form of a rebate, also known as a Part B give back plan. This rebate feature is typically offered with the Medicare Advantage plans without the drug coverage. Medicare Advantage, also known as Part C. Okay, these unique Medicare Advantage plans were designed for veterans because they cover everything except drug coverage. Well, VA veterans get their prescriptions mailed to their house. They already have excellent drug coverage, or they can go to the VA clinic and pick them up at their pharmacy, at the VA pharmacy. They don't need drug coverage through Medicare. Although vets are free to enroll in a Medicare drug coverage, and they will not be penalized. There's no Part D penalty. Every October 15th to December 7th, you can enroll in a Medicare Advantage plan without drugs, where you get the big Part B rebate, or with drugs. So this year, some of these zero premium Medicare Advantage plans without the drug coverage are giving my vets between $150 per month, even $185 Part B give back. These plans have a zero premium. Even if you love your VA doctors, you love the VA hospitals, but guys, you're throwing away $1,800 back, actually up to $2,200 if they give you the full rebate, all right? So, So regardless if you ever use your Part C Medicare Advantage plan, you love the VA, you're leaving a couple $1,000s on the table. In 2026, some carriers in some states will be offering Medicare Advantage plans without the drug coverage, and they're going to give back the whole $185 monthly premium. So that's paying nothing or very little to have Medicare Part A and Part B because some of these more robust Medicare Advantage plans, minus the drug coverage, are going to subsidize you so your Part B costs little to nothing per month. And my vets get dental, hearing, they get gym memberships, grocery cards, over the counter. So for folks with just the regular old VA health benefits who already have original Medicare, but they don't have the Part C Medicare Advantage plan that gives you the big rebate, you're leaving $1,800 to $2,220 per year on the table. Let the insurance company pay your Part B premium. Get more benefits at zero cost to you. So although Humana was the first to offer these plans, most all other companies now offer MA-only plans to vets. They go by names like the Patriot Plan, the Eagle Plan, the Honor Plan, patriotic names like that. So let's say, for example, you're a vet with VA benefits, you're turning 65 in November, and you're like my client, Chuck. Okay, I met Chuck in Savannah back in 2019. Chuck served in Vietnam. Because Chuck was already drawing Social Security benefits before he turned 65, Medicare automatically enrolled him in Part A and Part B. Sent him his card with his effective date on the card. He called me up and went berserk. When I told him, and this was in 2016, I said, yes, Part B will indeed cost you, Chuck, $121 a month. Since then, it's gone to $185. Chuck lost it. I begged him not to shoot the messenger. Chuck lost his leg at Quezon, lost more than a few of his friends over there, and damned if he was going to pay anything for anything. And he's right. He said, I served my country. I got a Purple Heart. I worked my whole life after NAM, and still I've got to pay. So I told Chuck, at the very least, he's going to want to keep his Medicare Part A, which is his hospital coverage, since he's paid into it his entire life through his FICA taxes. We figured out how much did Chuck pay into his Medicare. Well, we took his lifetime earnings and we multiply it by 1.45%. That'll give you a rough estimate of how much you've contributed. But on average, Chuck paid about $800 a year into the Medicare hospital fund for about 40 years. So first, I convinced him to keep his Part A since he's already paid for it. But unlike Part B, which now costs most folks $185 per month, Part A costs $0 as long as you worked 40 quarters, which is 10 years in your life, and you paid taxes during that time. So for vets, if you paid into the system, you worked 10 years in your life, get the Part A. There's no premium on that. Keep your Part A. You earned it. Now again, Part B, which costs most folks $185 per month, about 94% of all folks pay $185 a month, but about 7% of folks on Medicare pay more than $185 per month for Part B because their income is over $103,000 if they file single, they file jointly, and they make over $129K. They're going to pay more than the $185 per month. The more you make, the more you pay for your Part B premium. But, and again, Part B covers everything done outside the hospital, like doctor's visits, blood work, MRIs, outpatient surgery, cancer treatment, ambulance, sleep app machines, and on and on. So Chuck was adamant about declining Part B. He wanted to know how to ditch Part B and get a second Medicare card mailed to him with only Part A on it, because no way in hell was he paying for Part B. Until I empathized with him, I said, Chuck, listen, you have your regular VA benefits. This allows you to go to any VA facility across the U.S. and receive your care, any VA clinic, any VA hospital. However, now that you're turned 65, again, this was in 2016, you have the option of going on A and B, which is going to give you a ton more options. Because with your VA benefits, you can only get care at VA clinics and hospitals, but nowhere else will VA benefits work. But now with Medicare alongside, parallel with the VA benefits, you can go outside the VA to private doctors and hospitals. And this is what I told Chuck. I said, Chuck, you have veterans benefits on one side, Medicare benefits on the other side. These benefits do not interfere with each other. And at the time, Chuck and I were debating on getting Part B. So Chuck and I continued our debate. I strongly encouraged him to enroll in Part B. I pulled out the trump card, the Humana Honor Plan, back in 2016. And Humana was the very first Medicare Advantage plan to ever come out with an MA only with no drug coverage, designed for a give back for vets. They always have provided some of the largest Part B rebates. There's a lot of other companies that do it too, but Humana designed the first vet MA only plan, okay? In 2016, they gave a $100 rebate to Chuck. Now, back in 2016, Medicare Part B premium was $121. Today it's $185. Goes up every year. Humana gave him the $100 rebate. He's only paying $21 a month for Part B. But Chuck's last objection was, but I don't have any issues with my VA doctors. I love them. But I asked him some what-if questions. Let's play the what-if game. Like, what if shit hits the fan and you need major surgery? Or you have stage 4 cancer and the VA puts you on a 3-month waiting list? Or what if down the road you have eye issues, cataracts, detached retina? You don't want to drive 2 hours to the VA hospital. Once Chuck realized if he wanted to keep his VA doctor in Savannah, he could continue to use the VA benefits, because Medicare does not work inside the VA. Rather, it works outside the VA. But after a good hour back and forth, I said, look, if that rainy day ever comes and you need to see a cardiologist tomorrow, why not pay the $25 specialist visit, drive a mile from your home, get in and out and make sure you're okay rather than be put on a waiting list. So anyway, Chuck took my advice, kicking and screaming, enrolled in the Humana Honor Plan with no premium back in 2016. He opted out of the drug coverage because he gets drug coverage through the VA, and the drug coverage is excellent. And so fast forward to 2024, Chuck's still my client, but he got remarried, moved to New Philadelphia, Ohio. I know where New Philadelphia is. I used to work and live in Covington, Kentucky, and Cambridge, Ohio was part of my territory for all you Ohioans. So I reassured Chuck the Humana Honor Plan worked just as well in Ohio as it does in Savannah, Georgia. It's got a huge nationwide PPO network. He was happy that I'm licensed in Ohio. I'm licensed in 46 states. I can help him with claims and any issues he has throughout the year. And today, 2024, was 2023, 2024, the rebate's $150. Humana pays $150 of the $185 premium, Part B premium. Again, Chuck moved to New Philadelphia, Ohio, moved there, and loves the VA clinic there. He likes his new VA primary doctor, but last year, late 2023, early 2024, he went to the VA clinic, to a cardiologist at the VA. Within one visit, they knew you need a quadruple bypass, Chuck. And he had a congenital heart defect. So he had a couple things going on. Now, he checked in with the Lewis Stokes VA, the VA clinic, or the VA hospital in Cleveland. They were looking at like a 4-month waiting period to get him in to even consider the surgery. His wife pleaded with him. They called me, is the Humana Honor Plan in the Cleveland Clinic network? Of course they were in the network. It's a very robust nationwide network. 3,000 hospitals, they have like 500,000 providers in the Honor Plan network. And they call it the USAA Honor Plan now. They just label that with USAA. And with these zero premium plans, the cost for different medical services is in black and white in your summary of benefits. Joe was at the Cleveland Clinic for 2 different heart surgeries, was in a hospital bed for 8 straight days. After speaking with his wife a few times that week, we're lucky to still have Chuck. And she said there's nowhere in the U.S. she'd rather go to the Cleveland Clinic for heart or vascular surgery, #1 in the country. So he was admitted. Before he was admitted, I told him exactly what it was going to cost. I said, Chuck, you're going to pay $470 each day for days 1 through 5. After day 5, you don't pay anything. Chuck ended up paying $2,350 for 8 days, $2,350, 8 days in the Cleveland Clinic, 2 heart surgeries. Humana paid all costs after Chuck paid his $475 for days 1 through 5. And his wife called me when he got out of the hospital and said, I'm glad we made this choice, Chris. Humana even sent me prepared meals every day for the last few days. They do it for like 7 to 10 days. So they didn't have to fix dinner. It's been 1.5 years since Chuck's surgery. He's using Silver Sneakers gym memberships at Planet Fitness. He works out 3 to 5 days a week. It's one of the extra benefits the Honor Plan gives veterans. He uses most of his dental. He gets like $1,000 stipend. He gets $1,000 in dental. Once he uses it up, it's gone. He gets his glasses every year. His wife even uses most of the $75. They give you $75 in over-the-counter, a quarterly allowance. She gets Chuck baby aspirin stuff for her, and that's all fine and dandy. But the biggest benefit I see for vets into opting into enrolling in Medicare, as well as a Part C veterans plan, is the freedom to go outside the VA to receive the care from doctors and hospitals. Chuck just happened to live near the #1 heart hospital in the USA. So vets on VA health benefits that also enroll in Medicare Part A and Part B, they sleep better at night. Because when your health takes a turn for the worse, having a Medicare Advantage only veterans plan in your back pocket like Chuck did can literally be a lifesaver. So again, as a joke, Chuck's wife texted me the bill. It's this is not his bill claims the statements you get that scare the heck out of you. It was just north of $800,000. He paid his $470 for days 1 through 5. So the whole 8 days with the surgery and everything was $2,350. That's why you get a zero premium plan like this. All right. He could have waited months to get into, he could have waited for 3 or 4 months for surgery at the VA hospital in Cleveland, but you can't put a price tag on the freedom to get the care you want when you need it. That's why if you're a veteran, you should consider Part C Medicare Advantage plan, even maybe a supplement. But for vets, the MA only plan without the drug coverage is an excellent option. It basically pays your Part B premium for you. So just remember, the VA does not work outside of the VA administration, VA clinics and hospital. It doesn't work outside with Medicare. So you have two parallel healthcare systems that work great together separately. Below this video is a link where you can learn more about Medicare Advantage plans. But as a side note, let's pretend Chuck did not take my advice back in 2016. He only kept his Part A. He got rid of his Part B because he liked his VA coverage. Had he decided to enroll in Part B and delay that when he needed his surgery at the Cleveland Clinic back at the beginning of 2024, once he made the decision to get his heart surgery at the Cleveland Clinic and not the VA clinic, he'd have to pay a penalty for not enrolling in Part B way back in 2016 when he became eligible. Medicare tacks on a 10% penalty each year. Each and every year you postpone enrolling in Part B. So we went 8 years without Part B. Multiply 8 years times 10% per year. Now he has to pay 80% above the standard $185 per month Part B premium. So you just multiply 185 times 0.80. That equals an extra $148 extra each month for the rest of his life. So, because you remember, 2025, he pays $185 a month. He's going to have to pay the $148 penalty. So he's going to have to pay $333 a month for the rest of his life because he delayed. That's why when it comes to Medicare, in particular VA and Medicare, you want to work with a specialist, a Medicare specialist, independent Medicare broker who educates and empowers you. The jack of all trade clients that sell annuities, long-term care, life insurance, they dabble in Medicare between October 15th and December 7th. They often steer you wrong, not on purpose, but I've seen it happen. They can cost you thousands in penalties, which leads me to my next point. Folks with VA coverage that enroll in a plan like the Humana USAA Medicare Advantage plan, you are not married to it. You can change every October 15th to December 7th. Veterans can review their annual notice of change. That letter comes in the mail next week in September. This letter spells out all the changes in the plan. Chuck may decide in October some of his new heart medications aren't covered by the VA. Perhaps his list of drugs will be less if he changed to a Medicare Advantage plan with drug coverage. They also offer rebates, but not the $150 rebate. So your situation can change overnight. Chuck may decide in October some of his new heart meds are not covered by the VA, or perhaps his list of drugs would be less if he changed to Medicare Advantage plan with drug coverage. He could use the drug coverage through the VA, or he can use the drug coverage through the Medicare Advantage plan. Your situation can change overnight. These Advantage plans change each year. It's imperative you call a Medicare-only broker like myself to help you find the best path forward. And remember, the single biggest reason to enroll in both parts of Medicare, besides the fact that the Department of Veteran Affairs strongly recommends it, is that you'll have the freedom to go outside the VA system, especially if crap hits the fan, you get a serious chronic condition, you get cancer, you need a second opinion because your life depends on it. You could postpone enrolling in Medicare Part B, but understand you'll have a steep penalty that lasts the rest of your life. Guys, do me a huge favor. Click like, please subscribe. Again, please subscribe. What that does is it gets my name and my company out there to help other vets across the country. I'm licensed from East Coast to West Coast, and we don't know what we don't know. And there are 50% of all veterans. It was 42%, I think, in 2022. It's got to be 50% now. 50% of vets don't know about this. Those are the stats. 50% of vets on Medicare A and B are just, they have Medicare A and B. They got to pay 20% of everything instead of a smaller copay. This Medicare Advantage plan only without the prescription drug coverage, you know what it does? It's got a maximum out of pocket. If you ever did have to go get a lot of major stuff done, or you're going through cancer, they cut you off at a certain limit. And Medicare has no, original Medicare, the red, white, blue card, doesn't have a maximum amount of pocket. You could pay indefinitely, infinitely. With an Advantage plan, it varies between $6,000 and $9,000. If you ever spent that much, you're done paying for the year. I would think you go to the VA clinic for a lot of things, but you got free money out there. You got $185 a month that some of these companies are willing to pay for you with dental, vision, grocery cards, over-the-counter stuff, little doctor copays so you can go to the doctors outside of the VA network. People need to know about this. And you don't pay me anything for my services whatsoever. The insurance company pays me separate. Whether you go through me or go to Medicare.gov, you're going to pay a zero premium, get the same plan. So we'd love to help you with your claims, with whatever you need as far as Medicare goes, guys. So you have a great day.